A bold new plan by UNAids aims to end the epidemic by the year 2030. New data, in fact, from the organization shows that dozens of countries achieved or exceeded their 2020 targets. So in 2020, nearly 28 million people were being treated for HIV. This is up from just 7.8 million a decade earlier. Nearly 38 million people around the world are living with HIV. And according to UNAids, antiretroviral treatment has helped prevent 16 million deaths since 2001. In fact, Mary Mahy, UNAids epidemiology team leader, joins me now from Geneva. Thank you so much, Mary, for joining us this evening. How significant now has this new development come from UNAids, especially when in light of the fact that many countries are exceeding or even meeting their targets? Are we winning this war against this epidemic?
Thanks for the question. I think there's a long way to go. So we're 40 years into this global epidemic. And the fact that we're still not closer to reaching our targets is surprising and shocking. And so in some ways, while we have reasons to be happy, while we're seeing some good progress in some countries, we're also seeing that we're not achieving the goals in many other countries. So we still have, every year, we have 690,000 AIDS-related deaths and 1.5 million new infections. So we've still got a long way to go in terms of changing the way things are happening and ending this AIDS epidemic, which is the purpose of our whole effort and our new global strategy, is to try to make sure that we end AIDS by 2030.
Yeah, and it was also interesting to note, Mary, that according to the report, the number of people on treatment has more than tripled since 2010. Does that mean that when it comes to stigma, which is really associated with the AIDS epidemic, that there was a lot of stigma, there's a lot of stereotypes associated with it, that indeed we are able to now meet and confront this without having stigma attached to it, that people no longer see HIV as a death sentence or AIDS as a death sentence, but really rather something that you can live with, and live with, by the way, for an extensive period of time?
Yeah, so one of the things that's so important right now is pointing out where there's been successes and where we have been able to get people on treatment and reducing their AIDS deaths. We can map that against to where there's policies and laws that are more progressive and reduce that stigma and discrimination that happens to people living with HIV, but also kind of the key populations that are most at risk of HIV. So, for example, sex workers or men who have sex with men. If we have the progressive policies in place, the laws that will help and support those individuals to make sure that they're getting access to services, I guess, then we'll see that decline happening. And so there's a real diversity in what's happening. And so as a result, UNAIDS is pushing this idea of looking at where there's inequality and trying to close those gaps. Because when we can close those gaps, whether it's stigma, discrimination, we'll see the ending results of reducing new infections, reducing AIDS-related deaths.
Yeah, but is it not true that young women, particularly in sub-Saharan Africa, continue to be left behind? Why are they being left behind?
Absolutely. So young women 15 to 19 are 6 out of 7 of the adolescent infections in that age group are among young women 15 to 19. And so recognizing that we need to make sure that those young women, adolescent girls, young women, have the tools, the ability to protect themselves is critical. And when we see countries where those policies or those interventions are not being rolled out, that's where we see the continued new infections among those young girls 15 to 19.
Yeah, and I mean, given the fact that we are in the midst of a COVID-19 pandemic, how has this impacted the work that's been done by UNAIDS, the work that has been done by various countries to mitigate against the spread of HIV, and how are they faring in that regard? I understand that a lot of focus, a lot of resourcing has been placed on being able to contain this pandemic. And what does that say then on the war against AIDS and HIV?
Thanks. Yeah, so we've seen a lot of disruption due to COVID, especially last year as we were kind of trying to figure out, well, what will be the implications of COVID? And so we see in countries such as Mozambique, such as South Africa even, where there was a real downturn in services that were being available to people living with HIV, but also to protect people from getting infected. And so as a result, testing for HIV declined considerably. Newly starting on ART declined considerably. Male circumcision declined considerably. As a result, this bump in services means that we are not getting the protection that we would have liked, and that will take a hit on our attempt to reach the targets that we had set already back in 2016. So it's having an important toll. And I think we're still learning now what's happening with COVID. We've also gained a lot from COVID. We learned about ensuring that people that were on treatment had that treatment for 3 months or 6 months or 9 months so that they didn't have to keep going back to that clinic. So we've learned things from the COVID response, as well as lost a lot of traction in terms of achieving our goals.
Yeah, the impact of having the narrative change. So, for example, people living with HIV instead of people dying from HIV or AIDS, how significant of a change has just, being able to change that narrative had on the way in which people and even governments view the virus and view HIV and AIDS?
Yeah, I think you see a lot of governments who think, oh, this is done, we've succeeded, and they kind of step back and don't continue to make sure that services are provided and identify where the gaps in services are and the populations that are being left behind. As a result, you start to see increases in new infections taking place in those countries again because of that a sense of security of, oh, we've achieved it. So keeping up that political pressure to focus on the HIV epidemic and make sure that the services are being provided across the board is critical. And that's what's happening in New York next week, where we're trying to get governments to really sign on to this political declaration with the targets, the new targets that have been developed by UNAids, to make sure that they have all the policies, all the laws, all the interventions, the strong healthcare systems, the community-led response, all of that in place in order to really achieve those targets.
Yeah, and Mary, very quickly, before we let you go, we keep speaking about the targets, we keep speaking about the need to take antiretroviral drugs and the like. When are we going to have concrete discussions about the cure?
Yeah, I think that's a long, quick answer, but I think we've learned a lot with COVID. Let's hope we can take that COVID lessons learned and apply them now to HIV.
Mary Mahy, thank you so much for joining us. That is Mary Mahy, UNAids epidemiology team leader, giving us the latest there on that report. I do believe that indeed significantly more and more people are on ARV treatment.